Hello, this is Dr. Doe again. This video is on alphabetic list of problems. Continue with letter I. Today I'm going to talk about the iron deficiency and overload. Is there any emergency situation associated with these two conditions? Actually, yes. It's not because of the iron deficiency or the overload itself, but it's because of the associated complications. For example, the iron overload might cause the liver, the kidney, the pancreas, etc., other organs, or even the brain. If that's the case, then probably there is associated emergency situation with the impaired function of hepatic failure, or the brain damage, or the pancreatic caused diabetic and associated with the serious complications. In terms of iron deficiency, usually it's not an emergency because the iron deficiency is a long-term chronic process. It's not one day, a couple minutes, you need to see the emergency, unless it's associated with the other, like for example, the colon cancer can cause this iron deficiency because of chronic losing the blood and until one moment, either perforation or internal bleeding. So if that's the case, warrant the emergency. But just the iron deficiency itself, from the nutrition intake not enough intake, or the overload not causing the sudden the organ damage, so that's probably not associated with emergency. Are there any conditions that you can manage at home? Probably because the symptoms usually subtle, you either do not know or you know it, and your physician probably will give you a test, and otherwise you're either taking the iron supplement, prescribed medication, or the iron supplement from the over-the-counter. So it depends, but usually I think at least you need to be checked with the physician and to diagnose and to follow the otherwise either prescribed medication or over-the-counter the supplement. So basically still not, there's no condition that either iron deficiency or overload can be managed at home, but it's observed closely by the professionals. Your physician may ask you go periodically to check the lab to make sure the overload of ions or the deficiency of ions not progress to worse or not causing other damage. So that's basically has to be managed under the professional advice. So talk about the iron deficiency or iron overload. To end, none of them is good. None of them are good. It has to be in the optimal level. So the irons we either take from food, basically we take it from food, or recycle from the breakdown of the red blood cells, if you recall. And the iron, basically the function of the iron is really associated with the hemoglobin carry on oxygen to be oxidized and to be reduced to carry oxygen and relieve the oxygen from the lung onto the tissue, from ferrous to ferric. So these are the from the trivalent to bivalent. So these are the chemical process, but this chemical process really the fundamental, such significant biological roles in physiological role in the body associated with disease. So we know the iron two route to obtain the iron either from outside food intake or from the internal breakdown recycle for from the red blood cells and hemes. And where the ions go, where do we lose the ions? We lose it from the kidney, the skin, the breathing. So the iron will just coming out in subtle or insensible way to lose them. So have to be replenished, replaced. In normal condition, without internal bleeding, it's not easy to get iron deficiency unless, like a female, you're monthly losing blood. That is one of the risk factors for the iron deficiency, or chronic disease like kidney disease or chronic internal or subtle bleeding without obviously change color of the stool, or so that's probably the other cause, one of the most common cause of iron deficiency. In terms of the clinical presentation, the iron deficiency usually associated with, like I said, looking pale, losing weight, and if it's from the, regardless it's from the colon cancer is one of the risk factors, for example, or the female menstrual losing blood each month. So the symptoms, if the iron deficiency caused anemia, then look pale and feel tired easily, and without energy. So these are the signs of the iron deficiency anemia. So if those who have really heavy menstrual period, or have elderly people with the risk factors from the family, haven't done the colonoscopy, or haven't done colonoscopy, if you develop this pale, losing weight, and fatigue, so probably it's worth to check it, make sure there's no iron deficiency associated with this. So this is, I think it's kind of repeat from previously. I talked about the anemia, I mentioned about the iron deficiency anemia. The iron overload. The iron overload is may or may not associate with anemia. There's some diseases, thalassemia, anemia, for example. The iron cannot be metabolized, cannot be used, so also can cause anemia. Those are, I think I mentioned before, tend to occur in the along the Mediterranean and the southeast of Asia. They have this thalassemia anemia. So the iron overload, or sideroblastic anemia, is also the body cannot use the heme, cannot use the iron to synthesize the heme, cannot function, so still cause anemia. Or there's another chromcytosis, chromcytosis, which is the iron overload, is a genetic cause or the medication. So the iron overload basically can cause, in addition to the anemia, I mentioned that special two kinds, and also overload of ions in the body circulating will deposit in the joints, in the organs, can cause damage, either from the pancreas, if it has iron overload, can cause the diabetes or Browns, or the liver, if the iron overload will cause toxicity to the liver will undergo the cirrhosis. And also overload iron can cause damage to the red blood cells, to the brain, to the joint. So the overload of, when we talk about iron deficiency, is not good, but overload is also not good. Usually for the normal person, without any conditions, without any genetic causes, iron overload is not occurring, unless there's some medication or kidney disease or liver disease can associate with this iron overload. So basically, this is the video about iron deficiency and overload. It's kind of a repeat from what my previous video, and also introduce some other information about iron overload to those particular populations, either genetic or living in that special area, or taking some medication. I'm sure your physician probably will alert you if there's some medication can increase the risk of iron overload. So I'm going to stop here. Hope the video will help you, and particularly for those older people feel pale, fatigue, and losing weight, then go talk to your physician to check and make sure there's no subtle changes, internal bleeding. There's no precancerous or cancer diseases. So I'm going to stop here. Thank you for watching. I will see you next time.